Hello, my name is Jason Clam, Engagement Manager for Lower Cape Fear Life Care. Today I'm talking with our Chief Medical Officer, Dr. Kelly Erola, who oversees our hospice and palliative care programs that serve more than 1,000 patients each year in our region. So Dr. Erola, for those unfamiliar with Lower Cape Fear Life Care, can you share a little bit about the organization?
Lower Cape Fear Life Care was founded by community members 40 years ago. It's been here a long time and served thousands of patients and families. It started off as a hospice program, but in 2020 we changed the name from Lower Cape Fear Hospice to Lower Cape Fear Life Care because the spectrum of services broadened. Not only hospice is provided, but also a palliative care program, as well as a dementia program. We serve the counties of New Hanover, Brunswick, Columbus-Bladen, Onslow, Duplin, so we serve, a large area.
So you mentioned both hospice and palliative care. Can you explain a little bit about the difference between the two levels of care?
Hospice care is designed for a patient with serious illness who has a prognosis of less than 6 months if the disease runs its normal course. Of course, we never know exactly someone's prognosis, but it is prognosis-based. Hospice is a very comprehensive program led by an interdisciplinary team, and the team members include, physician, nurse's aide, chaplain, social work, volunteer, and this team develops an individualized care plan or treatment plan for the patient and family in order to best meet their needs during this very difficult and challenging time. Hospice provides not only the team, but also provides medications, DME, such as a hospital bed, oxygen, very practical things that a patient requires in their home. It also is delivered wherever the patient calls home. So it might be a residential home, it could be a facility in a nursing home, for example. So wherever the patient calls home, we deliver care. Most of our care is delivered in the patient's home. If a patient can't be managed at home, they have pain or symptoms that are too difficult, we do have 3 inpatient care centers that we do provide an inpatient level of care as well.
Well, hospice sounds pretty extensive, so how does that compare then to palliative care?
So palliative care is not prognosis-based. It's a patient who has a serious illness such as cancer, some type of lung disease, heart disease, Parkinson's, dementia. So a serious illness, not prognosis-based, but who needs an extra layer of support, who is having, pain or symptoms or issues with advanced care planning. And so it's an extra layer of support that the nurse practitioner comes to visit and assesses the patient and family and discusses different treatment options. The palliative care program works with the patient's own physician, so it's that extra layer in addition to the patient's treating physician. But I think the important thing to know is that it's not prognosis-based for palliative care.
Well, that sounds great too. How would I know which care is appropriate for me?
It can be challenging. You can always call us. We're always available to discuss which care is right for you. We also have a website called whichcare.org. So that's whichcare.org, and you can take a quiz and figure out which care might be right for you. But often calling and talking to our staff, and we can always send out a nurse to figure out which program would be the most suitable.
Well, we're also here hopefully near the end of the pandemic, and it has affected lots of things in our lives, including health care. How has it affected the services and programs of Lower Cape Fear Life Care?
The pandemic has been challenging for everyone, patients and families with difficulty with visiting and seeing their loved ones, for our staff. But we stepped up all our infection control policies, which were already good, but we had to make some changes because nobody knew about the pandemic and there are many unknowns. Followed the CDC guidelines. We were able to find personal protective equipment, and that was a challenge for many. But I think the important thing is we delivered safe care, and we have continued to deliver it throughout the pandemic. We have continued with our home visits. We have continued seeing patients, which I think is really important to note. We also did start a telehealth program as well for those that did not want the visit, or those who we're eligible for that service.
So just to kind of wrap up, if there was one thing that you would like people to know about our care, about our services, especially navigating through the pandemic, that you would like to make sure gets said before we're done.
We are here to help access our care. Patients and families deserve it, but they access it far too late. And that's what we see, and I hear from patients and families, particularly families, I wish we had known about you sooner. I wish that we had contacted you sooner to receive your help, because they find it so beneficial. And I really wish that people would contact us sooner.
Well, maybe this conversation is just the encouragement someone needs. Thanks for being with us today.
You're welcome.